doctors in every field of musculoskeletal medicine need to be educated that here we have a new modality of imaging that, although in theory, as I said, digital fluoroscopy is available before, was not available anywhere to the ease that it is now available, with the precision that it's now available with this device. The video fluoroscopy I've seen from X-ray departments, the best X-ray departments, simply does not give the kind of picture that I saw, and I was really astonished by seeing these first DMX pictures, and it was very useful because what it did was it showed the problem, and the problem was in motion. As I said, fluoroscopy is available in an X-ray department. In most departments, it's not digital. And the only way that I, as a practitioner, could see it, therefore, would be go there. I work 80 hours a week as it is. I don't have time to go and dig up the radiologist, dig up the tech, and roll the film. The beauty of this is it's digital, so it gets put on a disc and we can see it in our office. I think that when we remove the mystique and the mystery, patients have a much better outcome. And I'm positive of that from my own experience. And this is a great modality to be able to show them their own face, their own name, and say, this is your picture, and here's what's wrong. And they walk away feeling a lot better because they now have hope. If you just say, you need a major spine operation, and these are the risks, it could kill you, you can become paralyzed, they walk away terrified. That terror is certainly somatized into tension and headache and muscular tension and cardiovascular effects, and you name it. And patients, I think, don't have as good an outcome if they're not educated. If you are referred a patient from anybody, whether it's a fellow MD, a chiropractor, an osteopath, and they happen to bring along a disc with this picture, get it to work in your computer and look at it, because it's impressive and leads to a very important set of clinical information that will definitely alter your treatment. It brings out a whole new spectrum of understanding of injuries that would normally be blown off to your, man, you're nuts, man, you have chronic pain, man, you have chronic headaches, man, you need to be in chronic pain management, including high-dose narcotics for the rest of your life, man, you file for disability. That's, and maybe a significant part of that population, I can't tell you how much of that population, but a significant part of that population, in fact, has a real problem that digital motion X-ray may reveal. You actually see on the computer a simultaneous picture, a movie of the patient moving. And that's very valuable because you can see their actual movement in film and compare it dynamically, instantaneously to the abnormality of movement. And you can then look at their movement and say, ah, that pattern of movement is what's abnormal. In a way, it's almost educational for being able to almost, with time, I don't have that ability yet, but I foresee that perhaps I will get that ability if I see enough of these patients, that their pattern of movement might reveal this instability, that at least give a hint. Maybe they should get DMX. I think now that this modality is available, it's ridiculous that they not at least undergo the modality and determine if, in fact, there is a problem that we could address non-surgically or surgically, but at least identify the problem. And I think this is a very, very valuable modality. And again, video fluoroscopy has existed, but this makes it so much easier to obtain, so much easier to use. The modalities that she did go through, X-ray, as I said, CT scanning and MRI scanning, magnetic resonance imaging scanning, again, they demonstrate pathology in a frozen moment in time. And the problem with Amanda is she didn't have any pathology that you could look at a frozen moment in time. You have to see her spine moving to see that it was moving abnormally. This shows that the articular process of C1 has slipped off of C2. And that's the source of her problem. Frankly, if it slips, fortunately not in her case, but in another patient who, if it slips far enough, one can get profound spinal cord injury, and even if we see the injury, we would never know why without this type of picture.
you saw this picture, what was your reaction?
Wow, I've never quite seen anything like it in terms of an imaging study, and this explains Amanda's problem. Simple as that. I'll be very honest. I mean, had she come to me without this, I would have tried some different imaging modalities and tried some, if you will, tricks to see if I could figure out what's going on. I probably wouldn't have been able to figure out what's going on. I probably would have said, I can't help you. I don't know what's wrong with you.
But with this, you could see it almost instantaneously.
It's clear as day. So had she gone into another car accident, or had she said, I'm not going to live like this anymore, I'm going to start, I don't care what the pain is, I'm going to start working out. And she starts running and trips, it's quite possible she might have died or gotten severely paralyzed.